and welcome to our special show, Beat Diabetes, Myths and Facts. The coronavirus pandemic has affected our lives, our economy, our health, and nearly every aspect of our lives all over the world. The rapid spread of the new variant offers clues as to how SARS-CoV-2 is adapting and how the pandemic will play out over the next several months. The World Health Organization has said that the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach, therefore, is needed to promote healthier diets and increase physical activity, which can help in slowing down the diabetes epidemic and heart diseases. Beat Diabetes, Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today, we have with us a panel of experts to share with you advice on how to lead a healthier life. Dr. Ashish Saxena, he's a director and consultant diabetologist, Diabetes and Heart Center, Dr. Saxena Medi Center, Ludhiana. We have Dr. Nagamalesh U. He is a cardiology doctor and associate professor, Department of Cardiology, senior consultant cardiologist at the MS Ramaiah Narayan Heart Center in Bengaluru. We have Professor Dr. Rohan Sequeira. He is an endocrinologist, consultant physician and cardiovascular diabetologist joining us from Mumbai. Thank you very much, doctors, for being with us on the show. Dr. Saxena, to you first. The Omicron variant of COVID seems to produce milder symptoms and so far leading to fewer hospitalizations as compared to the Delta variant. Is this because of vaccination? And do people with diabetes really need to worry about it?
Yeah, this Omicron coronavirus, this variant which has come nowadays, the thing is it is spreading very fast. It is spreading rapidly as compared to the Delta virus. And as per the reports which have come in through various agencies, it is definitely having some milder symptoms, but it is too early to say anything because this is just a starting of a tsunami which is going to come because lots and lots of people are getting infected very fast. Yes, diabetic patients need to worry about this virus. It is very, very important for them to control their blood sugars because anybody who is a diabetic might be having some of the associated comorbid conditions. Either it might be obesity, it might be some heart disease or some renal function dysfunction or some dyslipidemia or blood pressure. And even those people who are purely only diabetics without any comorbid conditions, it will be very difficult for them once the virus catches them. See, diabetes is basically, anybody who's a diabetic is a fertile soil for any virus or any bacteria to come and implant because they're already immunocompromised. If the sugars are within normal range, that means they are absolutely normal to somebody who's a normal individual. Right. So these people have to be very, very careful.
All right. Very important advice there coming in. Dr. Sequeira, if I can bring you into the conversation, is it true that existing vaccines could be less effective against the fast-spreading COVID variant? And if yes, how will the booster dose of the vaccine really work?
Yeah, so
Dr. Sequeira, can you hear me? All right, we seem to have lost that line with Dr. Sequeira. We'll try and reconnect with him in just a bit. But all right, I believe Dr. Sequeira is back with us. Doctor, can you hear me? All right, we'll try and reconnect with Dr. Sequeira in just a bit. Dr. Nagamalesh, if I can come to you then, are people with heart conditions more at risk from the new COVID strain? Do these people need to get some tests done as a precautionary measure? What do you recommend?
See, at present, our knowledge about Omicron is very limited as far as the cardiovascular system is concerned. But our preliminary studies from South Africa suggest this is not different from the other variants, except it produces milder symptoms. But once they are infected, less number of patients are getting admitted to ICUs. And once they are inside ICUs, they all behave same. So it can affect cardiovascular system in a limited number of patients, but not very safe. But with this, we don't have any tests to suggest that there are some tests which prevent or protect this patient from virus. So this virus can produce myocarditis and heart attack and stroke. And there are some patients who had a severe myocarditis who came back to us for transplant. So these patients, they tend to affect, but we don't have any tests to say these are the cardiovascular patients which are more prone for the virus. The only way to protect is the prevention. So wear mask, vaccinate, that's the only way we can protect our patients. Otherwise, the number of patients who are affected by COVID and which can get into cardiovascular complications are same, but probably numbers may be less.
All right. Dr. Saxena, people with diabetes have an increased risk of developing a number of serious, health complications as well. Which are some of the most serious life-threatening complications associated with diabetes that viewers need to be aware of?
See, the viewers need to be very aware that diabetes can affect any organ of the body, right from the brain to the kidneys, to the heart, to the nerves, to the gut, to any organ of the body. It has to be under control. The most dreaded complications which we see in our day-to-day practice is those developing some cardiovascular complications. They might have dilated cardiomyopathy. Patients might have frequent heart attacks. Out of every 5 diabetics, 3 patients are hypertensive, and a comorbid conditions of diabetes and hypertension can increase the risk of having renal problems. Most of the patients get infected by some viruses or bacteria very frequently because the blood sugars are not controlled. The other thing which I have noticed is diabetic patients have a carefree attitude towards their disease when their blood sugars are high. They still consume a lot of sweets and other things which are actually not recommended, and the blood sugar goes beyond the range of 200 milligrams all the time, and it is not in the range. So they are more susceptible to develop more and more cardiac complications. What we say in diabetes, slimmer the waistline, longer the lifeline. So you need to control your sugars, you need to control your exercises, you have to be in an active phase of life. Yes, what you rightly pointed out, because of the coming of this COVID-19 virus and Omicron, a lot of lifestyles have been disrupted, especially my diabetic patients. What we are seeing, their sugars have gone haywire. Post-COVID also, the sugars have been haywire, and they need to be very controlled.
All right. Well, the important bit here, of course, is constant monitoring as well. Dr. Nagamalesh, if I can come to you, what about chest pain? You probably wouldn't ignore a pain in your chest, but people often dismiss, pain in their legs, say because of multiple, work-related or physical stress-related issues. Can heart problems also cause pain in the legs?
Yes, the heart problem and leg pain are related. So leg pain is mainly due to peripheral vascular disease, which is largely due to a clogging of the fat, that is atherosclerotic disease of the lower limb. The same atherosclerotic disease can affect even brain or heart. So it's all interrelated, so it's all vascular disease. So what are the symptoms? Symptoms are different for people who do exercise and get pain, and this pain can reduce when they take rest. So when they have a severe disease, they can have pain even at rest. So that's how it is. The cardiovascular disease and the atherosclerotic disease of the lower limb are related. So in one study, they shows that people who have lower limb, that is lower limb blood vessel disease, there are 50% chances of having heart disease also. So this is very important to diagnose the heart disease, those who are suffering from the lower limb disease. So once this is affected, it should be diagnosed early. It is very easy to diagnose by simple clinical examination, by palpating the blood vessels of the lower limb, and also by confirming by Doppler study or angiogram. And it is more common in patients who are diabetic or are not controlled, and most commonly smokers are most affected by lower limb blood vessel disease. And so these lower limb blood vessel disease and heart disease are very much related, and it should be diagnosed early and treated.
Right. I do believe that we have Dr. Sequeira back with us on the broadcast. Dr. Sequeira, we were asking you whether it's true that existing vaccines could actually be less effective against the Omicron variant. And if that is the case, then how will the booster dose work?
Right. So as we know from the onset of the COVID-19 pandemic that's been happening all over the world, we have realized one thing for a fact, that the COVID-19 virus has got a very high possibility of mutagenicity. That means it can change itself, and that's the reason why we've been seeing so many different kinds of variants. With the thousands and thousands of cases that we have been treating in the last 2 years, 2.5, 3 years, what we have realized is that as much as vaccines have a fantastic role in preventing seriousness of illness, as much as vaccines have an intense role in preventing the community spread, vaccines do have a limitation in that the newer variants might be affected a little less than what we would expect. So as much as vaccines are recommended, mandated and required, it is very important for the booster doses to augment the immune system so that the body's immunity does not go into a state of rest, and that the body's immunity always has the added advantage that the individual requires. So where the booster doses do come in is to give a jump start to the immune system once the body adapts to the vaccine. There are some vaccines which can give you this benefit for lifetime. There are some vaccines which require regular booster doses. So I do see a very, very strong role for the booster doses in these in this current endemic. Another thing is that the vaccines, when the newer vaccines come, and maybe the booster doses might include a different type of a vaccine to give you an added spectrum of immunity. But yes, a booster dose is very, very important to give you that jump start from what you were to where you are and where you will go. So I think it's very important that the government also initiates the policy, implements it, and that people do take the booster doses when they're made available, especially the older and the more vulnerable patients with a lot of comorbidities.
All right. Well, important clarification coming in there. We're going to slip into a very short break, but our panel of expert doctors will be live with us on the other side. Stay tuned. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Saxena, if I can come to you at the moment, we all know that people with diabetes are considered immunocompromised. People with diabetes are more susceptible to infections and complications. Is it a good idea to take flu shots for people who are suffering from diabetes? Dr. Saxena, can you hear me? All right, we seem to be having some audio connection problem with Dr. Saxena, but I'll try and connect with Dr. Sequeira then. Dr. Sequeira, the traditional way to monitor blood glucose levels is the fingertip prick blood test. People with uncontrolled diabetes may need to have multiple tests in a day. Can the CGMS be a good alternative?
So the finger blood test method has been something which has been validated for many, many years, and people have been using it. But there's a certain limitation with the fingertip blood test method. The fingertip blood test method, as much as it is accurate, gives you the blood sugar reading of a point in time. It tells you exactly what the blood sugar was at that particular point in time. Now, there are other ways of finding out a larger range of how much your sugar has been controlled, and that's something which people have been doing for some time now, called the HbA1c, which is the 3-month blood sugar average, which is a little bit more superior compared to the fingertip blood test method or the fasting and the postprandial sugar. Now, when you talk about a CGMS, what does CGMS mean? It's a continuous glucose monitoring system. In the sense, either somebody puts a chip on your body, which is measuring your sugars continuously, or they put a machine on your body which measures your blood sugar in real time. So what this machine does is, it sticks onto your body, it stays on your body and measures your body's blood sugar continuously every 30 seconds or every minute for 1 day, 2 days. There are some which do it for 7 days. There are some machines which do it for 14 days. So when you do a continuous glucose monitoring for 7 to 14 days, you actually get a real-time picture of how the patient's blood sugar fluctuates up and down. Now, with a finger prick test, you're getting the blood sugar at, let's say, 10 o'clock in the morning. You did a blood finger test. You got a report at 10 o'clock in the morning. But a continuous blood sugar monitoring will tell you exactly what your blood sugar has been right through the night, right through the day, on a continuous basis for 7 to 14 days. This becomes very, very important, especially when you're looking at type 1 diabetics. So looking at younger diabetic patients who are maybe in the age groups of 3, 4, 5, 6-year-old children. It also becomes very important in older patients who are not able to understand what is low sugar. So there you can actually minimize a lot of risk factors in these older patients. So yes, CGMS should be done at least once in all these high-risk patients.
Right. Dr. Nagamalesh, how does the viral infection affect the heart? Does the virus infect implanted devices, for instance?
No. Virus cannot infect implanted devices. So we use a lot of devices like pacemaker, ICDs, valves, LVAD, that is artificial heart. So fortunately, the virus cannot infect these. So this is not a listed infection for the devices. So because virus required a living cell to infect. So most commonly, the bacterial infections are very common. So because there is a foreign body in this device, so these bacteria can form colony in this and very difficult to eradicate. Fortunately, virus cannot do this, cannot affect this. So it required host, it required a living cell to survive. And once these devices are infected, mainly bacterial infection, so it can cause a serious problem, including death. So very difficult to treat these patients. So you asked one more question, how these virus affect the heart. This virus can affect directly the myocardium, causing the myocarditis, that is the infection of the heart muscle, which leads to severe heart dysfunction, arrhythmias, and even probably sometimes they land up with permanent damage to the heart. So few months back, a young advocate was referred to me. He was intubated and he suffered a major COVID and he recovered, and his heart function was just 20%, and he was referred for transplant. So it can affect so severely, and also it can cause blood clots within the blood vessels, causing heart attack and stroke.
Right.
But the new variants, we don't have evidence so far, but it might behave in the same way.
All right, so more research really needed to understand more about the new variant. Dr. Saxena, we all know that people with diabetes, I was asking you, are immunocompromised. They are more susceptible to infections, and therefore is the flu shot a good idea?
Yeah, flu shot is definitely recommended for all diabetic patients. The reason behind is that they are immunocompromised, and the chances of them should be to catch any infection is very, very susceptible to have infections. And the thing is, like when we are having this COVID going around, after the COVID vaccination, at least there should be a gap of about 3 to 4 weeks before taking a flu shot. Flu shot is recommended by CDC, by all the guidelines which are telling that adult vaccination is very, very important. It will give immunity against various seasonal diseases that keep on occurring. It will protect the person from developing any complications because they are poor in their stages of immunity. So flu shot is very, very essential for our diabetic patients.
All right. Well, all right. That's an important point that you're making there as well. But Dr. Saxena, there is a popular phrase, prevention is better than cure. What can one do to really prevent complications arising from diabetes?
Yeah, prevention is better than cure. Why we want to prevent any disease to come. Wearing a mask is to prevent, whether it is Omicron or whether it is COVID-19 or any variant. Similarly, when we were using polio drops, that was to prevent the polio to come set into our children. When we were kids, we also used to have that. So definitely prevention is better than cure. For a diabetic patient, the things which are required is a restful sleep. Nowadays, because of so many apps and other things, people are awake, their lifestyle has gone away. So they should have a good sleep. Their diet, their exercise, adherence to medicines is very, very important. They should not do their self-treatment. They need to have their physician or the consulting doctor to guide them, because whatever messages are coming in social media may not be appropriate for them. Every individual, his doctor knows what has to be done. So if you have your blood sugars under control, like doctor said, that with the CGMS you come to know what is the range. There is a time in range. There is a range of around 80 to 140 of blood sugar around the 24 hours. If you're having an HbA1c of say about 7, that means 17 to 18 hours of your sugars is under control, and you prevent all sorts of complications. Along with this, diet is also very, very important. You need to talk to your nutritionist or a dietitian or your doctor, have an appropriate diet so that all these things are settled and you have a very healthy and a smooth life going around.
All right, Dr. Sequeira, having a silent heart attack puts you at a greater risk of having another heart attack, which could, potentially be deadly. Why do people with diabetes experience silent heart attacks?
Right. So, as we know, diabetes is a metabolic disease. Along with all the other organs, a very high blood sugar over a period of time can affect the way your nerves can process information. So once your sugars have been elevated for a long period of time, sometimes patients will come to you with symptoms and they'll say, my fingers are tingling, my hands are tingling, I'm not able to walk on the floor. Every time we walk on the floor, we feel, altered sensorium. It's feeling like there's a feeling of walking on carpet. But just as you know, pain is a sensation of a nerve. The nerves transmit the pain information. So similarly, if the nerves in the legs and the hands are getting affected, it's very logical to presume that even the nerves affecting or supplying the heart can also get affected. So what we see is these patients have a lesser perception of pain and sensation compared to a normal individual. So when a person is having a heart attack, usually the first sensation is that I'm getting a chest pain. So that chest pain can also be altered in long-standing uncontrolled sugars. And these patients who are having long-term diabetes should be very, very vigilant of getting an ECG done and getting a cardiac evaluation done at least once in 3 to 6 months, so that they know that there's a basic evaluation done. Maybe a stress test once a year can give you a peace of mind.
Right.
So these patients have to be careful and realize that they can have an attack without knowing it, and there is definitely a possibility of that happening in the future.
All right. Dr. Nagamalesh, last question to you. There have been apprehensions that birth control pills can cause heart attacks. Are birth control pills a contributor to heart diseases?
To some extent, yes. So birth control pills have higher incidence of blood clot formation within the blood vessels. So there are two types of complications here. One is it can cause clot within the blood vessels, that is the arteries, and it can cause stroke and heart attack. Another is it can cause blood clots inside the veins and cause deep vein thrombosis and pulmonary embolism. So what is more common is DVT and pulmonary embolism, and heart attack and stroke is very rare. In one of the studies, they showed that 1.6-fold increase in the risk of this thrombus formation within the blood vessel compared to people who are not taking these medicines. But people who are taking estrogen of more than 50 micrograms have higher incidence, and those who are taking less than 30 micrograms have lesser incidence. And one more thing is the patients who are obese, who are diabetic, hypertension, and high cholesterol have higher incidence of this complication compared to people who are normal. So I have one lady now. She's around 35 years. She has started on oral contraceptive pill for some other gynec problem, not as a contraceptive. She landed up in deep vein thrombosis and pulmonary embolism. So like this, we keep seeing patients, but not very common. It is quite rare.
All right. Well, important clarifications there coming in. Thank you very much, doctors, for joining us on the broadcast. With that, we're slipping into a short break. News and updates continue on the other side. Stay with us.